Back injuries continue to be the largest exposure danger to any business. Each year, thousands of workers injure their backs on the job, costing millions of dollars in lost wages, cost of treatment, and lost production. This does not take into account the pain and suffering of the injured worker. Back injuries not only injure on the job, they can also change your life in an instant. What you took for granted in the past becomes a painful reality when you suffer a back injury. The little things you used to do, such as play a sport, carry your children, and many other common tasks now become something you can only dream about. The truth is, back injuries are usually for a lifetime. Back injuries are considered by OSHA, the Occupational Safety and Health Administration, as the nation's #1 workplace safety problem. Back injuries are often very painful. They result usually in intense pain, and they take a long time to heal. A long-term or lifetime disability. Back injuries are not a quick fix injury. This type of injury requires extensive surgery and rehabilitation time. Expensive to diagnose and treat. If the injury is severe enough surgery, then a long period or physical therapy and rehab is a real outcome. The best way to prevent this type of injury is to follow the guidelines in this lesson. Most back problems are related to your spine. Your spine is made up of many small bones called vertebrae. These vertebrae are spaced by spinal discs that act as shock absorbers to cushion and separate your vertebrae. Your spine serves not only to help you sit or stand upright, but also to protect your spinal cord. Your spinal cord is the main information highway for your entire body, and is composed of millions of nerves. Because your spine is a delicate structure, you will experience pain whenever you strain, sprain, or in some way injure your back. Take a moment to take this short quiz and see if you can answer correctly. Hopefully you picked the first answer, 1. It is important that you remember that these injuries are very painful and that they require extensive time to heal. Let's move on the course. There are many causes to back pain, and we're going to cover a few during this course. Standing, sitting, or lying down incorrectly will put strain on your spine. Your spine is designed to operate best when it is in a natural S shape. Bending this natural S out of shape for long periods of time can often lead to muscle fatigue and back pain. This is why you stretch backwards when you experience back tension. Without thinking, you are trying to adjust your spine back to its natural S shape. Your overall physical condition can affect your back. If your back muscles are weak, or if you have put on a few pounds, your back must work harder. Making your back work harder can lead to back pain. Tight and knotted muscles, which are caused by tension and stress, can cause muscle spasms and back pain. Tension and stress come from all sides, such as deadlines in production, a boss that wants it done now, or equipment problems on your production line. These stressors can also come from the home, problems with the family, bills. All can have a direct impact on you and your job. The Occupational Safety and Health Administration, OSHA, as well as the Bureau of Labor Statistics, understand that we are now dealing with an older workforce, and this is causing a large impact on our job sites. It is important to remember that as we age, the muscles in our back lose their strength and ability to function. One of the discs in your spine can slip out of place and press on the nerves in your back. Osteoarthritis, a form of arthritis, can cause back pain, as well as kidney and prostate problems. Being in an accident either on or off the job where your spine is injured will produce serious back pain. Examples of impact trauma include, but aren't limited to, falls, slips, being struck by materials or equipment, or being involved in an auto accident. Repetitive trauma, or RMI, repetitive motion injuries, can result in the same type of back injury as any of the previous causes. Working in an awkward position or lifting incorrectly over a period of time can cause what are known as cumulative trauma disorders, CTDs. As you repeat an unhealthy position or movement, small injuries begin to add up. If you do not change how or what you are doing, most serious injuries can occur. Take a moment to take this short quiz and see if you can answer correctly. If you picked answer 2, you are correct. Poor posture and stress as well as repetitive trauma are all leading causes of back pain and injury. Let's move on in the course. Proper lifting techniques, proper loading techniques, and knowing when too much is enough is extremely important when it comes to the prevention of back injuries. In most work situations, objects that are very heavy are lifted and carried by machines such as forklifts or other lifting equipment. However, there are times when you may have to lift, adjust, or carry a heavy object. It is at these times that you run the risk of injuring your back. Before lifting and carrying a heavy object, take a few moments to assess the situation. How far will you have to carry the load? Is the way clear of clutter, cords, slippery areas, overhang, stairs, curbs, or uneven surfaces? Will there be doors that are closed? Ask someone to hold the door open or place a wedge under the door to hold it open. Once you get the load up, will you be able to see over the load, or will the load block your view? Can the load be disassembled, carried in pieces, and then reassembled? Now take a few moments to size up the load. Test the weight by lifting a corner of the object. If it is too heavy or if the object is in odd shape, stop. Ask for help. 2 or 3 people lifting a heavy object are much safer than trying to do it yourself. Use a hand truck, push cart, or a mechanical lifting device. Consider using gloves that will improve your grip and protect your hands. Never lift anything unless you are sure you can do it safely. Take a moment to take this short quiz and see if you can answer correctly. If you picked true, you are correct. Always test the load before attempting to move or lift. This good practice could save you years of pain and suffering for making the wrong choice. Let's move on in the course. The key to lifting safely is keeping your back straight or slightly arched. Never use your back to lift. Start the lift by putting your feet close to the object. Get a firm footing. Center your body over your feet. Squat down like a professional weightlifter, bending your knees. Keep your back straight or slightly arched. You want your legs to do the lifting, not your back. Grasp the load securely with your hands and pull the load close to you. Smoothly lift straight up. Never twist your body while lifting, keeping your head up, as if looking straight ahead, not down. As you carry the load, it is important that you remember the following tips. Keep your back straight or slightly arched. Walk slowly and surely. Use your feet to change directions. Never twist your back. Avoid leaning over. Avoid lifting a load over your head. If you become tired, set the load down and rest for a few moments. And remember again to check the path you will be using to carry the load. Make sure that there are no obstacles and that all doors and overheads are open so you don't need to stop while carrying the load. Setting the load down is the reverse of lifting. Position yourself where you want to set the load. Squat down. Let your legs do the work, not your back. Remember not to twist your body while setting down a load and keep your head up. Once the load is where you want it, release your grip. Never release your grip on a load until it is secure. You don't want to drop a load on your foot. Or, if someone is helping you, dropping a load unexpectedly can injure the other person. Take a moment to take this short quiz and see if you can answer correctly. If you pick number 3, you are correct. You should never twist your back when carrying any load. This will put undue stress and otherwise place your spine out of alignment, thus causing pain and injury. Let's move on in the course. When a load is too large for you or another worker to pick up or move safely, then use the appropriate machine to assist in the load. Do not try to be a Superman. Lost records are full of individuals who either thought they could do it or didn't want to wait until they could get the necessary equipment to do the job safely. These Supermen are the ones that fill accident reports across the country. Remember to get help and not become a statistic. When using a hand truck or push cart, always remember that it is easier and safer to push than to pull. Stay close to the load. Try not to lean over and keep your back straight or slightly arched. Always use both hands to control the hand truck or push cart. Use tie-down straps if necessary to secure the load. Avoid stairs and inclines, and if you must take a load to another floor, use a freight elevator. Finally, never horse around with hand trucks and push carts. If an object is too heavy to lift or carry with a hand truck or load onto a push cart, then use a forklift. Always remember to never attempt to operate a forklift or other piece of lifting equipment unless you have been trained and authorized by your organization to do so. These laws and fines and penalties can be levied by OSHA should you violate these rules. Take a moment to take this short quiz and see if you can answer correctly. If you pick number 2, you are correct. You should never bend over or otherwise place your back in an unsafe or awkward position while moving or using any device. Proper alignment and posture is the key to maintaining a healthy back and avoiding accidents. Let's move on in the course. The best way to prevent back injuries is to maintain a healthy back. As always, the best defense is a good offense. The same is true with your back. When standing, always remember to stand up straight and never slouch. If you must stand for long periods of time, use a footrest or anti-fatigue mats, and always select and use appropriate footwear that is comfortable. Believe it or not, sitting is actually harder on your back than standing. Remember to sit up straight, and again, don't slouch. If you must sit for long periods of time, consider using a pillow or towel to support your lower back. Select and use a chair that fits you. Make sure that when you are sitting that your knees are slightly higher than your hips. Select a mattress that doesn't sag or replace the one that does. Sleep on your side with your knees bent or on your back. Avoid sleeping on your stomach with your head resting on a stack of pillows. After work, get off the couch, get outside, and get some exercise. For example, go for a walk, ride a bike, jog, swim, play tennis, golf, or basketball. Remember to maintain a good posture throughout your exercise session. If you have a history of back or other health problems, check with your doctor before starting any strenuous exercise program. If for some reason you can't get outside, the following indoor exercises will help you maintain a healthy back. Lie down on your back with your knees bent. Raise one knee at a time to your chest and hold it for 30 seconds. Lower your foot to the floor and raise the other knee. Repeat this exercise 6 times for each leg. Lie down on your back with your knees bent. Put your arms on your chest. Raise your body 6 to 8 inches off the floor. Hold for 5 seconds and then relax. Repeat 6 times. Starting at a standing position, balance yourself by holding onto a stationary object, such as the back of a chair. Bend your knees and squat down about halfway to the floor. Hold this position for several seconds. Stand up. Repeat 6 times. Lie face down on the floor with your head resting on your folded arms. Lift your right leg up from your hip until you feel the muscles stretch. Inhale while lifting up your leg and exhale while lowering your leg. Return to your starting position. Relax. Repeat the exercise with your left leg. Repeat 8 to 10 times for both legs. Take a moment to take this short quiz and see if you can answer correctly. If you didn't pick false, then we have a problem. The best way to maintain a healthy body and to work safely is to exercise regularly and stay ready for your job each and every day. Stay at a healthy weight. Being overweight puts extra strain on your back. Select foods that are good for you and help you to keep your weight down. Avoid foods that are high in fats and sugar. Foods that are high in fiber and low in salt are much better for you and your back. We have covered a lot of information, but it is all very simple to remember. Make sure that you know how to properly lift an object to avoid injury. Always test the weight of the load before you attempt the lift, and if it is too great, get assistance. If the weight is too great for two to lift, then use proper lifting equipment for the job. You are reminded that only authorized forklift drivers are permitted to operate the lifts. And if you are not certified, get someone who is to assist. Remember to keep your back and the rest of your body in shape for the job at hand. This includes proper exercise and proper nutrition each and every day. Finally, remember that your back is your greatest asset, and it is your responsibility to protect it. Back injuries are always painful, and most severe injuries will last a lifetime, and they will affect you and your loved ones for years to come. If you don't take care of your back, it can't take care of you. This course is presented by the PDS Office of Risk Management, and information has been gathered from the Occupational Safety and Health Administration. Thank you.